NCLEX RN Test 2026 questions that reveal your true exam readiness level. Question 1. Which laboratory finding is associated with HELLP syndrome in a pregnant client? Option A, elevated blood glucose. Option B, elevated platelet count. Option C, elevated creatinine clearance. Option D, elevated hepatic enzymes. The correct answer is option D, elevated hepatic enzymes. HELLP stands for hemolysis, elevated liver enzymes, and low platelets. Elevated AST and ALT levels are key diagnostic markers. Question 2. Which method is used to elicit the biceps reflex during a physical assessment? Option A, thumb on the antecubital space, tap thumb with reflex hammer. Option B, loosely suspend the arm while tapping the back of the elbow. Option C is strike the area below the patella while legs dangle. Option D is strike the muscle insert just above the wrist. The correct answer is option A, thumb on the antecubital space, tap thumb with reflex hammer. To elicit the biceps reflex, the nurse places their thumb over the biceps tendon in the antecubital fossa and strikes the thumb. Question 3. A prima gravida with diabetes is at 34 weeks gestation. Which doctor's order should the nurse question? Option A, magnesium sulfate 4gm4. Option B, abretine, terbutaline, 10 mg/g4. Option C, Stadol 1 mg for push. Option D, Ansef 2gm IVPB. The correct answer is option B, abretine, terbutaline, 10 mg/g4. Abretine, terbutaline, is a beta-mimetic used to stop preterm labor, but it can cause significant hyperglycemia, making it dangerous for a diabetic client. Question 4. An amniocentesis at 32 weeks shows an L/S ratio of 1:1 in the presence of phosphatidylglycerol. How should the nurse assess this? Option A, the infant is at low risk for anomalies. Option B, the infant is at high risk for growth retardation. Option C, the infant is at high risk for respiratory distress syndrome. Option D, the infant is at high risk for birth trauma. The correct answer is option C. Infant is at high risk for respiratory distress syndrome. An L/S ratio of 2:1 is needed for lung maturity. A ratio of 1:1 indicates immature lungs and a high risk for respiratory distress syndrome, RDS. Question 5. Which observation in the newborn of a diabetic mother requires immediate intervention? Option A, crying. Option B, wakefulness. Option C, jitteriness. Option D, yawning. The correct answer is option C, jitteriness. Jitteriness is a primary sign of hypoglycemia in a neonate, which is a common and dangerous complication for infants of diabetic mothers whose blood sugar drops after birth. Question 6. What is an expected, non-toxic, side effect of intravenous magnesium sulfate therapy? Option A, decreased urinary output. Option B, hypersomnolence. Option C, absence of knee-jerk reflex. Option D, decreased respiratory rate. The correct answer is option B, hypersomnolence. Hypersomnolence, drowsiness, or feeling warm is an expected effect. Decreased urine output, absent reflexes, and respiratory depression are signs of magnesium toxicity. Question 7. If a client receives epidural anesthesia and experiences hypotension, what is the nurse's priority action? Option A, place her in Trendelenburg position. Option B, decrease the rate of 4 infusion. Option C, administer oxygen per nasal cannula. Option D, increase the rate of the 4 infusion. The correct answer is option D, increase the rate of the 4 infusion. Epidural anesthesia causes vasodilation. Increasing the 4 fluid rate, bolus, helps restore blood pressure and maintain placental perfusion. Trendelenburg should be avoided as it can cause the block to move higher. Question 8. Which nursing diagnosis is the highest priority for a client with cancer of the pancreas? Option A, alteration in nutrition. Option B, alteration in bowel elimination. Option C, alteration in skin integrity. Option D, ineffective individual coping. The correct answer is option A, alteration in nutrition. Pancreatic cancer causes profound malabsorption and anorexia, making alteration in nutrition, less than body requirements, a critical physiological priority. Question 9. What is the best method for the nurse to use to determine early ascites in a client? Option A. Inspection of the abdomen for enlargement. Option B. Bimanual palpation for hepatomegaly. Option C. Daily measurement of abdominal girth. Option D. The assessment for a fluid wave. The correct answer is option C. Daily measurement of abdominal girth. Daily measurement of abdominal girth at the same location, usually the umbilicus, is the most objective and sensitive way to detect early fluid accumulation and monitor progress.